Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm Colin Hung, and I'm here at the annual MGMA Leaders Conference. It's a conference that I really enjoy coming to. And whenever I'm here, I always try to meet up with MGMA executives. I think they have a very unique perspective on the industry, especially given how much they interact with their members. This year, I had the chance to sit down with Ron Holder, Chief Operating Officer at MGMA. I wanted to find out what he is seeing in terms of challenges that the industry is facing. I also wanted to find out what technologies have him excited. And lastly, I wanted to find out what's coming next for MGMA itself. I hope you enjoy this conversation. Ron, welcome to the program.
Yes, thanks for having me, Colin.
It's great to have you back.
Yes.
I'm excited to be back here at the MGMA Annual Leaders Conference.
Yeah.
Now, we did a little preview with some of the MGMA team prior to this conference, and we spoke about how you're changing things up a little bit and going with some new content, trying to attract new people. How are you finding it so far?
So we've had good things said so far to us by attendees. We have a great mix this year of people that are new to MGMA, as well as some old timers, if you will, that maybe hadn't been back through the pandemic and stuff, and this is their first conference back, which we love to see because we love our super engaged members that have been with us for a long time. But we also, vital to any organization is an infusion of new blood, and so we had 260 people sign up for our first time attendee reception, which is great. We got 1,500-ish of educational attendees plus all the speakers and staff and all those kind of things, and so it's a good increase. We're still not quite back to pre-pandemic levels, but we're continuing to climb back from where it was right after the pandemic. So
for sure,
we're super excited about it. Fresh content, things specific to role-based content for higher level leaders, but mixed in general practice administrator content and things like that too. So we've got a wide variety of content for a wide variety of attendees. Our CEO Summit this year, we just launched it last year. We had 8. In our first year, we had over 60 in our sessions yesterday and today, which we're thrilled about.
And you have that new hosted buyer program as well. That kicked off yesterday.
Exactly, where basically vendors were able to pay for the registration of some attendees in exchange for meeting with multiple vendors. So right. It's a win-win-win. Win for MGMA, win for the attendee, and win for the vendor and our partner.
And certainly, just touring the exhibit hall, I know it's only been early days yet, but the exhibit hall just feels more full this year, and that's a great sign.
Well, it feels more full from an attendee perspective, but it almost doesn't feel as full with regards to how it feels from a clutter, because what we did is we kept the same amount of space and gave everyone a little bit more area to spread out so that it was, I guess, a little more open,
right,
and didn't feel as restrictive. We limited the number of vendors so that we could have a better ratio of attendees to vendors, which makes it a better experience for all of our vendors that are partnering with us to make the show a reality. We can't do a show like this without heavy vendor involvement.
Absolutely.
So vital to us.
Absolutely, absolutely. So let's talk a little bit about what you're seeing as an association in terms of the challenges that you feel your members are facing right now, other than staffing, which we know is always a top issue, and revenue, which is always a top issue. What are some of the other challenges that you're seeing that your members kind of struggle with this year?
Yeah, I mean, you touched on revenue, of course. I can't not say revenue. It's hospitals and other elements of healthcare got cost of living increases, and if anything, we're looking at potential cuts on the way. So that's a big deal. Staffing, as you mentioned. Tech, incorporating tech in meaningful ways. Our keynote speaker just mentioned that of all industries, healthcare is really the only one that IT has not significantly helped the productivity of the people who do it with. That is a function of it's helping in so many ways. You have to do it. But sometimes the EHR, sometimes other things are adding steps along the way that we haven't really leveraged and figured out how to do it efficiently or make use of, like meaningful use data, all the stuff that we have to capture. What are we doing with it? Right? So how do we make it more additive than it has been in the past? How do we keep it from intruding in the patient, physician encounter, that relationship kind of thing? So that's all that's all part of it and the challenge. And I think one of the coolest things that I'm starting to see is a lot more use of like handheld devices
Interesting. Okay.
in physician encounters. So the last time I went to the physician's office, there was no computer in the room, none, zero. And the medical assistant had a handheld and clicked all the things that you would normally do on an EHR, entered in all my information, my history, did the pre-workup, all those things before the provider even came in the room. But no one ever had their back to me, right? And they were able to engage with me just like I am with you right now, right? Face to face, taking notes. And it was really cool. And I just don't see a whole lot of that yet. And I think that's something that can really be additive to the whole experience from an efficiency sake, but also the patient satisfaction.
What are the opportunities, Ron, that you're seeing as you look across the landscape where practices can really make a difference either for the patients or for their clinician, their staff?
I feel like right now we still haven't leveraged, and it'll take time for people to get used to it, but if you can't get staff, you have to look at are there ways to minimize the number of staff you need.
Right.
And that could be anything from check-in kiosk, automation of doing all your pre-registration before you even come in the clinic, doing things via the patient portal, asking questions and triage, so you don't even maybe need to come in for a visit, right? All those type of things are great opportunities in that regard. I think that AI, of course, AI is how can that be additive, and how can it not just from a revenue perspective or an efficiency perspective, but even from the clinical perspective, right? How can it help providers be efficient in making decisions? Like, based on what you entered, these are the things you need to consider that the patient may have. I think we're quite a ways away, and maybe never, from, your doctor robot will see you now where it's all done by AI, but I certainly think that they can help narrow down physicians to help look at specific things, diagnostic, looking at MRIs and finding maybe things that to the naked eye. The risk there, I think, could be over-reliance, right? If you as a provider take what the AI feeds you, they say, it looks like it's this on the MRI, or we don't even call this part AI right now, but taking what you entered in the medical record and doing the after visit summary, spitting it out based on just a few information points. If you're not actually actively reading that stuff and it becomes part of the document or the record and you sign it and all this, it's not the AI's note. They don't have legal, they don't have any legal issues with that. It's you're the provider. So you can't over rely on it. It's still your note. You still have to review, you still do those things, but it could, obviously help you a lot.
And Ron, as you look across, your members right now and your organization, where are you hoping that a year from now, when we get back together, where are we going to be? What are we going to be really talking about?
I don't think any of this has got just a 12-month or less
Okay.
runway. I think AI is going to continue to be something that we're talking about at this time next year. Of like, and maybe some of the things like it's helped out a lot, but here's headaches we have, or those kind of things. I think that in hospitals, you're starting to see some interesting tech things, and I'm not sure necessarily right now how this translates to medical practices, but I'm hearing about hospitals that are automating via robots, actually, a lot of stocking of supplies, or taking courier things between different departments. And it's like, it's not just surgical robots and things like that anymore. They're actually doing some replacement of functions. Like, can they sanitize the room after a patient leaves? How much of that requires a real person anymore? Things like that. And so translating those kind of assistive devices into medical practice is going to be a challenge. I still think there's a big curve for wearables and remote monitoring that hasn't been fully tapped. A lot of practices, especially the bigger practices that can get over that initial the financial outlay to get into that, they're doing it. But the smaller practices who maybe haven't been able to do that yet, it'll happen.
Right.
They're going to have to. They're going to have to compete. Remote monitoring, those kind of things. So,
I can't not ask you a question, at least a little bit around policy.
Yeah.
Where's MGMA putting some of their effort around policies and things coming from Washington?
Well, so we're worried about the cuts to the 3% across the board this next year. That's going to hurt. I mean, you look at what practices are having to pay compared to previous year or 2 years ago or 3 years ago for staffing
Absolutely.
in order to be efficient. So that's a big one. I think, prior authorizations is always a challenge.
Big hurdle. Yeah.
Come on. If 99.99% of the time, if you get the provider on the phone, you're going to approve it, why do you need to talk to someone every time? Right. So there's just a lot of challenges like that. And there's not a lot happening in Washington right now because of the stalemate between the Senate and the House.
Sure.
So, but something to watch. Always is.
Ron, again, if we were getting together a year from now, what am I going to see from MGMA? What are some of the changes that are happening at the organization?
So we are continuing to look at our membership models and our conference strategy. One of the first things that organizations cut if there's economic struggles is professional development. So that's always a challenge.
Right.
We want to make it easy for them. We're looking at some models with regards to more but smaller conferences, so that people don't have to travel as far, maybe not even need a hotel or something like that, but can continue to participate with us, engage with their colleagues, things like that. We have new products. We're launching a physician business training.
Okay.
That is going to allow administrators to have tools to bring their physicians along in a way that they understand the basics that they don't get in medical school or during their residency or fellowship, that in order to be a productive member of their practice in society, and minimize financial risk, those kind of things, which is cool. But we're also going to be working and looking to work with those same residency and fellowship programs of is this something that you would like to partner with us on as an offering to your graduates, so your graduates can leave and be successful. We launched, I think a year ago, maybe a little over a year ago, Data Discovery, which is a product that we have that pairs your practice's data with benchmarks, and you can see how you compare in certain aspects of your business, so that you can then drill down into it and work on the issues that your practice is having. It's not just your data, because you need to know that your data, where it doesn't measure up and where you're doing really well at those kind of things. And of course, we're refining our data collection tools, because our surveys is a big part of what we do, so that people can continue to offer market appropriate packages to their physicians, fair market value. So we're launching and continuing to develop a tool that will allow people to upload their salary and productivity information instead of filling out an Excel spreadsheet or submitting something, and just make it easy for people to do that, because that's what we're about. MGMA's mission in a nutshell is to make the business of medicine easy for the physicians and the practices that we partner with to help make healthcare better.
And I love those surveys. I got to tell you, whenever you guys come up with a new survey, I am on top of it. I love reading the statistics on it. So I do appreciate all that information you're sharing. Ron, you shared a lot of information with us today. Where can people go to find more information about MGMA? MGMA.com
is the number one source for that information. You can find out about being a member, when our next events are, all the online resources we have, Data Dive, Data Discovery, all those types of things. And as a plug for that, we are only about 3 months out from having completely revitalized and changed our website around, because we had so many complaints and issues with it about inability to find stuff, and it's really slick now.
Amazing. Ron, well, thank you for being on our program today. I really appreciate it.
Glad to have it, as always, Colin. Thank you.
Hey, I want to thank Ron for coming on camera with me today. It was really refreshing to hear his take on prior authorization, something that 99% of the time doesn't actually change the care that's provided to the patient. So maybe as an industry, we should be gently pushing back against this requirement. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.